Hello, everyone, and welcome. On behalf of the whole MixTech team, I would like to thank you and welcome you to Module 2, the Matrix Overview, which is part of our Data, the Tip of the Iceberg series. My name is Ashley Fuss, and I am the Director of Evaluation here at the McSilver Institute. And we are joined today by my colleague, Chris Copeland. Chris?
Hi everybody. I'm looking forward to going through this overview of the matrix with you today.
Great. So next, we're going to take a look at our agenda. So for today, we are going to, we already did our welcome and introductions. We'll talk a little bit about the series format and overview, talk about the balanced scorecard approach. Then we'll do kind of a deep dive of the overview into what the matrix, and specifically we'll look at these role definitions and our 5 domains. We'll look in detail at our data matrix, and then we'll talk a little bit about our next module.
So to introduce the matrix, I want to talk a little bit about a balanced scorecard. I think we all know the effective management of an agency really requires us these days more and more to balance seemingly competing pressures, the finance, the quality, compliance, for instance. They all need to be managed equally. But I think more often than not, most hard data that we have is financial, the profit and loss statements, cash, etc. And that often lies within finance and within senior staff. And because we often lack other data, it's often this data that's made decisions about the whole agency. But while the bottom line is absolutely crucial, and using the oft-used message that there's no mission without margin, it really doesn't tell the whole story. So what a balanced scorecard approach attempts to do is make other domains, other data elements as important as the ones that are readily available. So we'll be talking about data that's to do with the people we serve, to do with outcomes, to do with quality. And the matrix that we're going to be looking at, and we'll be explaining in detail, tries to create an environment where all that data is available and equally useful, so that we begin to make decisions based not just on one set of data, but in a balanced way across the agency. And crucially, I think it's important to keep in mind that any of the data that we're looking at has to be linked closely to the mission statement, so that when we talk about data and making decisions, that they roll up to the mission statement. And as we go through this this presentation now, you begin to see how that works. So the data matrix is really an array of data that takes elements from across the agency. And what we've done is highlighted data both horizontally and vertically across the agency. By horizontally, what we mean is across different organizational domains, often silos within an agency. So we're going to be talking about finance, about human resources, about quality measures, about data that's relevant to the population, the people we serve, and also outcome data. And not only are we going to be looking at the data across the horizontal domains that I've just mentioned, but also vertically, in terms of the data that the leadership at an agency level needs, the data that department and program managers need, the data that supervisors need, and the data that staff need as well. So that's the horizontal and the vertical review of data we'll be looking at. And it's important to note that I think that the data, the way we're presenting this is a suggestion about the data that's going to be useful. But crucially, a lot of this data needs to be modified to be specific for the agency. So look a little bit more detail about the vertical role definitions. So we're using roles rather than job titles. And the reason for that is that people within an organization can have multiple roles. So somebody who's managing a program is also somebody who may be supervising staff, and the data that they need as a program manager and the way they use it is quite different from the data they would need as a supervisor. So we're going to be looking at data that the leadership, who are responsible for the overall financial, cultural, and quality of the agency, we're going to be looking at data that department and program managers need. And this isn't just about the the managers of programs and services, but also for the support department as well. We'll be looking at supervision data. So for those folks, that role is people who are directly responsible for their staff, their subordinates' performance. And we'll also be looking at staff, at the data that staff needs, and that's all staff. This is staff from, as I've described here, from maintenance through to the CEO. We're all accountable, and we all have responsibilities, and we should all have data that we're able to measure our performance against. And then horizontally across the agency, we're going to be looking at data that falls into these 5 different areas. And so the departments that often have hard data are finance, human resources, and compliance, as they've described. But we also need to add in, if we're going to have a balanced approach to this, data around the people that are being served by the agency and the outcomes that are that the agency can demonstrate externally. So we need to be able to understand the mission of our agency, some of the process measures that we get from finance and HR, but also what are the outcomes? How is this agency improving the lives of the people we serve? So that's the way that the data is going to be organized. And here it is. And what you're going to be seeing here is each of those domains, each of those areas, we're going to begin to populate with data that we believe is important for being able to manage an agency effectively. And as we look at these different areas, what we're looking at is whether the data is available and whether it's available in a way that's actionable. And I think the interesting thing about this matrix is that, as I said before, that the data that's hard and usable is often in the top left-hand corner of this matrix. And as we get further away from the finance, human resources towards outcomes, and further away from the leadership and the staff, then less and less likely is hard actionable data available to be used. So as we look at this matrix, I hope it's going to be useful to think about where the gaps are in your data and the use of data, and begin to use this as a management tool, as a strategic planning tool, to look at the elements within this matrix, look at where you have data that's available within each of these elements, and look at the gaps and strategize which of the data that you don't have you want to get, you want to complete, and you want to be useful. And the gap analysis tool that we'll be showing in module 4 is a way of looking at the agency, looking at where the gaps are, and what that gap analysis tool will produce a report for you to be able to begin to have an action plan about filling in this data matrix. So, looking at a little bit more detail, each of these areas have data that should be available in order to be able to manage effectively an agency. So if you look at the financial domain, you can see that the data that's required is different at a leadership level than it is for staff. Both should have data available, both should be a data that's actionable, so we can understand not only the performance of the agency, but of the performance of individual staff. Just to go through some examples. So at an agency level, we're going to be wanting to know cash on hand and projected. We're going to be wanting to know agency and performance financial profit and loss statements. We're going to want to understand the balance sheet. We may want to understand, if applicable, collection rates by program and census by program. So these are examples of data that's often looked at a leadership level to understand how the overall agency is performing. But as we move down towards the department or program leads, that overall data becomes less useful, because what staff managing programs need is that data broken down by their program with specific targets, such as overtime and revenue, where program census, collection rates, and program and staff productivity, for example, are presented to program managers in a way that they can manage the agency, their programs themselves. So a more detailed look at the available data for them. And supervisors need yet another level of data. Their data is going to be around their own staff's productivity and performance. What are the data? What are the performance standards that have been set up for individual staff? And do supervisors have readily available information on their supervisees' performance in a way that's timely and actionable? And similarly, staff need to understand their own productivity, their own performance, and that needs to be available in a way that staff understand and able to take action of their own performance. So each of those data elements is different in how fine the detail is and how it may be used. And without data within each of those four individual areas, it's going to be difficult for either staff to manage their own performance, supervisors to manage their supervisees, program managers to be able to manage their programs, or agency leadership to be able to manage the overall agency. So each of these domains has a similar sort of set of data that's required. At an agency level, for human resources or staffing, it's going to be really important to understand agency turnover, salaries against market, vacancies by positions, time to fill vacancies, the satisfaction feedback for agency and program from the staff, and also staff demographics. These are broad data sets that are important to understand how effectively the agency can recruit and keep staff, and how satisfied staff are within the agency. But that overall agency information isn't going to be useful unless it's broken down by department, by program. So individual managers can look at their own programs in terms of turnover against satisfaction and vacancies to make sure that they're managing the program using data that's accurate about their own staff, and the vacancies and the satisfaction of staff within their programs. Again, supervisors were going to need individual data that relates to the individual performance goals of their individual supervisees. So it's one thing to set up a set of performance goals for a staff member. It's another to have data to measure their performance against it. And again, staff would need that data as well in order for them to be able to manage their own performance. Again, without data broken down into the individual, into these discrete domains, it's very difficult to have an agency that is managed by data rather than anecdotal information. It's often the case that program managers would not be able to talk about the vacancies and turnover when faced with lack of productivity. Without those two pieces of data, the productivity of the individual staff, and also the number of vacancies and how long it's taken to fill vacancies, it's very difficult to manage a program. Quality compliance. Quality compliance and data for that would mean that the agency would have done an assessment about risk. It would need to understand which programs, which activities that the agency is most at risk at. It would need to set a set of quality standards. If we are going to articulate to other stakeholders the quality of the work being provided within an agency, leadership of the agency need to set what those quality standards are. The agency leadership also needs to understand incidents across an agency. When that risk assessment has been completed and when those quality standards are being set, again, we can begin to look at individual program results against audited against audited contractual agreements, against quality standards, and begin to look at incidents by program. Supervisors need that information to be able to understand how their individual staff are performing, and staff need that sort of information to understand the quality of their work and the standards of it against audited compliance standards. Again, all these different data sets need to be readily available if we're able to manage an agency at these discrete levels. Moving on to some of the data that may be less readily available or less readily countable, the people that are being served need to be understood not only individually, which is often the case, but also more as a population. So it's important to understand at an agency level who the people we're serving are. And this may seem very obvious, but do we really understand the breakdown of the people we see in terms of their age, their gender, where they live, their diagnosis, their ethnicity, and even their pay source? Do we know, are we able to look at that and see trends and patterns within those demographics? Do we provide the people we serve in with the ability to report on their own satisfaction? It's critically important to be asking people who receive services what it's like to receive that service. Now, traditionally, what we've done is ask that about how do you feel about services once a year. But I think increasingly it's important to be able to ask, how was the last service you received? Was it to your satisfaction? Because without that, and in terms of the increase in competition, we don't know whether people are not coming back because the treatment wasn't appropriate, or whether the feeling about coming into a clinic or receiving services in a shelter felt supportive. So all that information, again, there's obviously a very clear pattern about that, needs to be broken down by department, by supervisor, and by clinicians, so people understand not only individually what they're doing, but also the impact they're having on a broader range of people that they're providing the services for, and how does a program impact the cohort of people it's seeing. In addition to the demographic data, it's also important that individual staff have at least one clinical indicator. And when I mean clinical, I mean anything to do with the services we provided. I've given an example here of one of the major clinical indicators, the DLA-20, which attempts to measure people's functional improvement. But any indicator that gives the ability for staff to understand progress that they're making as individual staff, but also shared with clients, with the people we're serving, so people who receive services can begin to understand their progress as well. That data becomes incredibly important in terms of the individual treatment. Other data in terms of population begins to give the agency and the program a sense of how they're performing overall. And lastly, we need to be looking at outcomes. This is an area where each agency has to define a set of outcomes that are relevant to its mission. How do we as a provider understand that the services we provide have a definitive, clear outcome that is positive on the people we're providing services for, or the community we're providing services within? No longer is it appropriate to say we do good work. We have to be able to say, not as a process measure, such as we see 800 people in a month, but we need to be able to say, of those 800 people, how many people receive services that improve the quality of their life? How many of those people who we serve got a job and are now independent? So those outcomes are going to be defined specific to the agency and specific to the work that the agency does. Again, those outcomes need to be understood at a program level, at a supervisory level, and an individual staff level. So This is an example of what a completed matrix would look like. Needs to be completed on an agency by agency level. Some of this data points are not relevant for some agencies, but all of these areas, all of these domains, all of this matrix needs to be completed by some data elements to be able to manage an agency effectively. I think one last point to make is that the agency mission should be laid across this. So any of these data points, any of this work that's been done should lead up to the mission statement. And I think one of the neat things about the way this is laid out is each of these areas within this matrix, working from the staff through the supervisor to the program to the agency level, should be like nesting dolls in that the data connects from from staff to supervisors to programs to agency leadership to mission, and it can be an effective way of helping staff understand how their individual work, the data that we use around their productivity, their evaluation, the measurements against quality standards, the individual clinical work they're doing, how that connects to the mission statement. And a data matrix like this completed and shared with staff can be an effective way of helping people understand the connection between their work and the mission. So again, just to repeat some from the first module, some of the further learning that's available through the work from the Performance-Driven Academy. This information we're giving here in these modules can be further enhanced by a much deeper dive that the Performance-Driven Academy is providing. And again, any questions or discussions, please send to that email address, and we will get back to you as soon as we can. And we look forward to catching up with you in the next two sessions, which will talk a little bit more about data, but also present to you the gap analysis tool that will help you complete that data matrix and see where the gaps are in the data within the agency. And thank you for listening, and we'll look forward to seeing you at the next webinar. Thank you.